Dr. Miriam, unmuting yourself.
Thank you. Thank you. Hi, everybody. I'm Miriam Gonzalez. I'm going to be today with you and Dr. Velez. It's a pleasure for us to be training in PFA and talking about how could we apply this model in today's life in the reality that we are living right now, pandemic COVID-19. So it's our interest to talk about how could you apply the model to what we are working today. The population is struggling with the COVID-19, and how could we help them, okay? So before I start with the training, I would like to acknowledge and say that the Psychological First Aid Field Operation Guide was originally developed and revised by the National Child Traumatic Stress Network and the National Center of PTSD, okay? In the slide, you could see the principals authors of this edition, and you will have access to the manual, okay? I think in the handouts, Cindy put it there for you. So you will have the whole manual, and what we're gonna be talking is almost in the manual, almost everything. I think the only thing that maybe you will not find right away in the manual, it would be how to apply it to the COVID-19. So that's the kind of information that extra that I will be giving to you today. But the rest of the slides are all contained in the manual. So you will have it there for you, okay? So let's move a little bit to what are our objectives for the training for today, okay? As all we know, we have been living with COVID-19 in these days, and that this really changed, pandemic really changed our lives. We are dealing with a lot of uncertainty. It has altered our daily routine. A lot of people are struggling with financial pressures. They lost their employments. Kids, children are not going to school. We're moving to homeschooling with all the difficulties that that means. I could talk about professionals. If we're not too technological, we have learned about it because it's a must right now in what is going on in our country. And therefore, a lot of worry. People are worried about getting sick. Some people are dealing with somebody, their significant other or son of their loved one has died from COVID or are in a hospital. There's a lot of stress in their life right now. And they may be experiencing a lot of stress, sadness, fear, hopelessness. So in today's webinar, one of our objectives is to provide tools through this model of PFA so you could help people that are struggling with COVID-19, okay? In Puerto Rico, we've been struggling with COVID. We've been struggling with earthquakes. So there are a lot of disasters going on, and there's a lot of stress going on in our island, okay? So also part of the objectives we're going to be trying to reach today, okay, is that you could know what's the model, what's the approach, what is PFA, and we also want to describe 8 strategies or core action, basic core actions that are the components of the model, okay? We will also like to discuss with you guidelines for providers, okay? If you're going to be a provider of PFA, we want to share with you some guidelines that will really help you to deliver PFA. We also want to talk about self-care. You may be a provider. If you're a provider, you should always consider self-care. What you need to know and how could you care and how could you make a decision if you're going to be a provider before you start providing PFA. What kind of self-care do you need during and after? So we'll talk about that a little bit on Wednesday, okay, when we are almost finishing the webinar, okay? So those are our objectives for today's presentation. Next slide, please. We're going to start talking, and I was talking with Dr. Velez and telling her that usually the introduction and overview of the model is the part that takes more time explaining, okay? But we would like to explain a little bit what is PFA, what are the strengths of this approach, who is this approach for? There are some people who could benefit from PFA. There are other people that will not benefit from PFA. So we want to share that kind of information with you, okay? When should psychological first aid be used? We're going to be talking about that. Where could you provide this kind of service, okay? Who is the persons who could deliver psychological first aid, the basic objectives of the approach, and some considerations that you should have if you're going to be a provider of PFA. So that's an overview of what we're going to be talking in this part of the webinar. Okay, let's move to our next slide, please. What is psychological first aid? Okay, and the answer to that question is there is a human, supportive, informed, modular approach to help people who are suffering from a disaster experience, a pandemic as we are living right now, an emergency, okay? The model integrates public health, community, and individual psychology. It is really a secondary prevention model. So we're trying to help people before they could present some kind of disorder or mental health problem. So if we do this kind of prevention, we'll try that people do not get to have a disorder later on, okay? It's important to know that this model does not assume severe mental health problem or long-term difficulties in recovery. It is based on the understanding that disaster survivors or pandemic survivors could experience a broad range of early reactions, especially in the first 1 or 2 weeks of an earthquake, or people with the lockdown. Those first 1 or 2 weeks, most people will present some kinds of signs, okay, of stressful reaction to that event. I love to say that it's not abnormal the reaction people is having to the pandemic or to an earthquake. What is really abnormal in our life is having a pandemic. I haven't lived before a pandemic. What about you? What about my mother? She said no. What about my grandmother? She also said no. So this is a very, very this is a experience that most people, that nobody have lived before. Okay, so it is. We could think that during the COVID-19 pandemic, the whole population is likely to be affected in some degree, including children, young people, older adults. Some people may have a specific traumatic experience, such as getting the illness. Not everybody is going to get the illness, but yet there's some people having the illness. Some people are working with grieving. A significant other die from COVID-19. So they're going through that process right now, okay? Some people are dealing with a distant isolation, and that is really difficult for them. So some people may have obvious signs of distress. Many people will experience immediate distress, but they will quickly recover. And that's the point, and that's the information we want to share with you. Most of the people will have some distress, but most of them, maybe 80% or more, okay, will move quickly and recover quickly, especially if they have family support, community support, people who they could talk about it. That will help a lot, so people could speed on the recovery process, and there is a highly possibility that they will not experience any kind of mental health disorder, okay? So sometimes we think there is a lot of mental health problems, but really most of the people are resilient. They have the support and they will move and they will quickly, okay, be dealing with the stressors in an adaptive way. And that's very important for you to know when you're dealing with this kind of situation. Could we move to our next slide? Okay. So let's talk now with some of the strength of the PFA model. One of the strengths of the model is that it has a rapid assessment. You could rapid go to the place, to the field, to talk with people, and you will be taught how to do a rapid assessment. So you could get information about the needs and concerns that people may have during the pandemic or during the disaster, okay? Also, it's very important to know that it's an evidence-based approach, okay? Another great strength of PFA, and you will see it in the manual, is that it emphasizes on developmental, cultural and spiritual appropriate interventions. Most of the intervention you will see in the manual, okay? Instruction if the person is an adult. The same, another kind of instruction if you're dealing with the same tool with the children, okay? And if you're working with other older adults, what you should do. So everything is in the manual. You just get the manual, read it on it, and you will have all the information. But it's very, very good, okay? And also one of the things that I love is that in the manual you will have some handouts, okay? And most of the handouts are tools or will describe how people could do breathing exercise, how could people deal with intrusive thoughts, and they will have guidelines how to go through those signals or responses they are having. I usually have my carpet, I'm going to show you, right? So if I am delivering PFA, I will just move and have the handouts right with me so I could handle them to my clients or to the person who I am working with, so they could take home their handouts and they could read it. Sometimes, not to make so many copies, one of the secrets that I use is that I tell them if they have a cellular phone to make a picture, okay? So they will have right there, okay, what are the steps if they need to do, let's say, breathing exercise. How do I do that? So they will go to a cellular phone, go to photos, see the instructions if they could do it by themselves, and that would help a lot. So you could handle the handouts to them, you could discuss the handle with them, they could take photo and they would have all the information, and that is great. So that's a very good tool, okay? And you will have them in your manual. Okay, let's go to our next. Okay, what PFA is not, okay? It's not professional counseling, okay? In our polling questions, the question was if it's counseling, if it's a psychiatric intervention. No, it's not, okay? It's not. It's a prevention. We're dealing with prevention, okay? It's not debriefing, you know. Sometimes people will talk and talk and talk what happened, right? But that doesn't mean they're going to resolve and they're going to move to the next step. So it's not only about debriefing. It's not, and you will see that one of the instructions of the model is that we try not to get survivors to give us details of what happened. We just want to know what they need and see how could we support them in what they need in that moment, okay? So that's what that is what PFA is not. It's not counseling, it's not a psychiatric intervention, it's not debriefing, okay? And we should not be asking for so many details. We're only gonna ask, and we're gonna talk a little bit more about that when we get to the court action that works with that. We only are gonna ask for the questions or the information that we really need so we could assess what their needs and concerns are and what are we going to be giving them in the intervention that we're going to be making, okay? So let's keep moving, okay? PFS is not for distressed people who have been recently exposed to serious crisis, even people with serious life-threatening injuries, okay? People who need medical care, you need to move right away, okay, and help them with medical care. You are not using PF with people who may have suicide thoughts or homicide thoughts, okay? So for who is PFA? PFA is for people that are struggling with stressors, okay, during a pandemic or during a disaster, and their coping mechanisms maybe are not because they don't have it. Maybe they have good coping mechanisms, but they are so stressed out they could not access, okay, the tools that they already have. So we want to provide them, okay, with tools to work with the distress and to work with the need. And that's the person who would really benefit from a PFA approach, okay? PFA can also be provided by first responders and other disasters workers that would help also to them, all this information. So let's move to our next slide, please. When should PFA should be delivered? It should be immediately following the incidents, right? What's going on now? Let's talk about COVID-19. Now, if we're talking about COVID-19, reality is that it's a prolonged incident. We haven't moved. We're still in the pandemic. So that's the point right now. People are struggling with all the distress, but we still have pandemic with us. So it's a prolonged incident that may persist, and also we're having people all the time reacting to the stressors they're having right now. Okay, so it's important for you to know that, right? When should PFA be used? Immediately, hours later, and a couple of weeks after the event. What I'm trying to explain in terms of COVID-19 is that COVID-19 is not an event that is already over. We are in the crisis right now. So right now, you could use all the tools that we will be discussing with you to help people, okay, cope with the situation that we're going through, okay? I usually give another webinar is about SPR. SPR is a model that you could use month, years later of the event, okay? But PFA is immediately the incident has occurred or is occurring, okay? That's the difference between both, okay? Let's move on to our next slide, please. Where should PFA be used? It is designed to deliver in diverse settings, okay? It's a community, in shelters, in hospitals, okay? In acute care facilities, emergency operations center. You could go to people's home in Puerto Rico, in AMSCA. They have some workers that they will visit community, okay? And they visit them at home, and they will deliver PFA at people's home, okay? That is possible also, okay? So you could use a lot of fields. You don't need a new office. You don't have to give an appointment, people to go to the office and talk to you. That's not the point in PFA. In the earthquake, we will go to the shelter where the people were in Ponce and in the South region, and wherever we get them, we could make the intervention in that place, okay? So let's move on, please, to our next slide. Who could deliver PFA, okay? PFA is designed to be delivered by mental health and other disaster response workers. What that means. You don't need to be a psychologist, a psychiatric, a social worker to deliver PFA, but you should be trained in PFA if you're going to deliver PFA, okay? So that is very important for you to know. Okay, and you know what? Some people delivers PFA and they don't know they are doing it. That's very interesting. And you'll see people helping others and they don't know about PFA, but they are doing something very likely to what is PFA, okay? So that's important for you also to know. Okay, let's keep moving. What are the objectives of PFA? Okay, number one, and I love this one, and we will see some videos, and you will love them also. But in the videos, you could see this human connection. It's a non-intrusive intervention, okay? You don't bother people going after them. You need to talk. No, you respect when people wants to talk with you. They're open to hear them and work with them. If people don't want any kind of intervention, we will also respect that, okay? So if you don't have permission, if the person doesn't give you the permission to work with them, to talk with them, you should respect that. It's very, very important. Also, one of the objectives is to be compassion. One of the things that I love from the model is that they are always validating, normalizing the experience. Oh, I have a lot of anxiety about COVID. You know, I think we all have anxiety about COVID. It's a very natural response in the situation that we are right now. So yeah, the reaction you're having, most of the people are having the same reaction. That doesn't mean you're crazy. You need to go to a psychologist. No, 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 no. It's a reaction that we are waiting for it. You know, it's normal to feel the way that you are feeling right now. So that is one of the objectives, to normalize. And we use a lot of validation. It's a tough work. Yes, it's very tough. It's very difficult. Yes, it's very difficult. It's difficult to handle uncertainty. Yes, it's very difficult to handle uncertainty. You know, you need to always be validating what people are feeling, okay? Another basic objective is to enhance immediate and ongoing safety and providing emotional comfort. So what that means is that when you are providing PFA, you want to see if people are safe and you want to move them as soon as possible to be in a safe place. If you're in an earthquake and the living conditions are not safe for people and you go to that community to help or provide PFA, you want to right away move people to a safe place where they could be. You want people to have water. You want people to have food. That's our first intervention. Try to see the basic need and supply and help them to reach those needs. Emotional. People may be very overwhelmed if they have information that their COVID test is positive, or emotional discomfort if there's an earthquake. Totally normal. People will be very, very anxious and they will have a lot of emotional reactions. So just be with them. You know what? in Puerto Rico when the earthquake occurred in January. And I saw this by television, and you talk, and the TV people went over there and they make some interviews to people, and they say they feel okay because there was a lot of people going down to the south and were providing support to them. So that was so important, feeling supported by others. You don't know how much that counts in people's life. So that's one of the things we want to do in this model. Okay, provide support to others. Be calm and orient emotionally overwhelmed. You could not be struggling with your own anxiety and trying to help another person with anxiety. So first you need to be calm so you could give that calmness to other people. Okay, very important. Help survivors to tell you specifically, that's the point there, specifically, okay, what are their immediate needs and concerns. So you need to gather information. How could I help you? What do you need right away? Water? Let's get water. You need food? Let's get food. You need shelter? You need to go to the hospital? Let's go to the hospital, okay? You're gonna provide that immediate need for the person there, okay? And offer practical assistance and information to help survivor address their immediate needs and concern. And we're gonna talk a little bit more about that point in other slides, so keep it in mind, okay? Let's move to our next slide, please. Another of the basic objective is to connect. The word connect is link is very important in PFA. We want to link persons with other social support or other significant person in their life, services they need. That is one of the main roles that PFA providers will be delivering, okay, will be doing. They will be connecting people. So to connect people with services, it's important that you as a provider should know about what kind of services are there for these people. How could we help them, okay? What's the government doing? What financial services or helps are providing people? What cares about in COVID? How could people look for loan if they're having financial problems? If they're having living problem because it was an earthquake, let's suppose that, what is the government doing right there to help people, okay, have a living? What living arrangements we need to make? So that information is important for you to know about it, okay? Support adaptive coping. You know what? Some people, they think they're not dealing well with the pandemic, or they might think that they do not deal well with the earthquake, but they are really good. And they are really using very good coping strategies to deal with the distress. So maybe your intervention as a provider, PFA provider, is just to communicate to that person, you're doing great. You're doing a great job. That is what you're supposed to do. You don't need help. You're doing it perfectly by yourself, okay? So we want to encourage people to be active, to have an active role in that recovery process after a disaster or in the pandemic. We want to reinforce that a lot. You're active. It's in your hand what you can do, okay? That's very important part of the objectives, okay? Provide information that might help survivors cope effectively with psychological impact of disaster or in the pandemic. Right now, and it's in the literature, on when there are disaster or in the pandemic experience that we're having, some of the mechanisms some people use is drinking more alcohol or using drugs. That's not a good coping mechanism to deal with their distress. So we need to help people get tools and recognize and use effectively coping mechanism that really will help them go through the experience they are having right now and the stressors they are having right now. Okay, sometimes we need to give them orientation that maybe you could drink and maybe you're going to feel relaxed 1 hour or two, but later on you will have more problems. Okay, so that's important for you to let them know. Okay, and also we want to link survivors to another member of the disaster response team or local recovery system, mental health services, public sector services, or organization. We want to help them, you know, we want to link them with other persons. Dealing with COVID-19, I was dealing with this young adult. She was about 25 years old, and she was really sad because she was not having too much communication or the kind of communication she wants to have with her friends. And I talked to her and I said, hey, have you tried a Zoom party on Friday night? And she said, a Zoom party on Friday night? And I said, yeah, I do a lot of Zoom parties on Friday night with my friends. Oh, I never thought about it. I was really surprised, you know, I'm older and I was assuming that young people knew about doing Zoom parties, okay, on Friday. But she said, no, I have never tried. Oh, that's a very good idea. I'm gonna try it right now. I'm gonna send the invitation to my friend and we will have, and I told her, and you have to get dressed real pretty, okay? This is a party. You should get dressed. Oh, that's good. I'm gonna put people how they should get dressed for the Zoom party. So let's do that. So you see this kind of information that sometimes we assume, and one of the things that PFA say, don't assume, okay? Because we may get wrong with it. But sometimes they have so much stress that sometimes things that are obvious for us are not obvious for other people. So you should take that in consideration also. Okay, let's move to our next slide, please. Considerations delivering psychological first aid. Number one, if you are going to the field, especially if you're going to be working in field, operate within the framework of an authorized disaster response system. I remember when the earthquake in Puerto Rico occurred in January, I was thinking to go with a voluntary group to provide help. And I called a community leader in Jauco. And the community lead, I told her, oh, we're going to be there about 9 a.m. And she told me, don't come at 9 a.m. You will not reach anybody at that time. And I said, really? Why? And she told me, you know why? Because the earthquake occurred at 4 a.m. So most of survivor people are awake the whole night. They could not sleep. And they will go to sleep in the morning. So if you come early in the morning, you will not find nobody there you could talk with and help. So they recommend that if we were going to provide service, we should go after 3 p.m. You see? So that kind of information, if you don't talk with the community leaders, you won't have that kind of information. And you need that kind of information because you don't want to lose your time going to the south. And when you get there to provide your help, everybody's sleeping. So that's not the point, you see? So it's important to see what's the role. It's very important also that when you deliver PFA, you need to know which one is your role. I am a psychologist, right? And maybe I could help people manage stress signals or reactions, but I could not help anybody manage something that has to do with physical health because I'm not a doctor. So that's not my role. If I am there and somebody asks me about illness or something that has to do with physical health, What do I need to do? I need to refer that person to the specialist, the doctor that could help him deal with health issues, because that I'm not prepared to do that, you know. I'm not a social worker. I'm not a case manager neither. And sometimes survival will ask, what about living arrangement? What about employment? Who could take care of my kids? That's something that's going on right now with the COVID. If I'm a mom and I have to go to work and there's going to be homeschooling, there's somebody could help this kind of mother so they could work and somebody could take care of the kids. So we need to have that information, okay, before we get to help people, because they will ask and we don't have the information. So we need information, or we need to refer people, okay, to the specialist or the person who has the information and could give the information to them, okay. Very important also that you should always have being respectful to the people, working with empathy. We need a lot of empathy to work with people. We cannot be judgmental. Oh, you're not the only one. Hey, there's other people that have more problems that you really do. You know, bad intervention. You don't do that kind of thing, okay? So it's important for you to be empathy, have the empathy with all these people that are needing help, okay? Look at another bullet, said be visible and available. Sometimes when we went to the South in the earthquake, we will just have some kind of t-shirt, and maybe it will say the name of the organization that we were representing and how could we help. And we could walk around the community to see who needs help, and then we could give the help to that person. So just be there. Maybe you could maybe you could reach a person, could I help you with something? And maybe the answer will be, no, thank you, I don't need any help. And you say, okay, it's okay, I will be around. If later on you think you need some kind of help, you just reach me, I'll be there. That's a very nice intervention in that moment, okay? And one of the problems in where we deliver PFA is confidentiality issues, because in my office it's very private, nobody could go in without my permission, and we have a safe space to talk with people, then nobody else will be listening what we're talking. But when we're working with disasters, that's not always the truth in those kind of environment. Sometimes you're in the field and you have a family here, you have other people here. Think about a shelter. How many people could be in the shelter? And you're delivering the service to somebody that is in the shelter. So sometimes you could just say, could we move over there to the tree and we could talk there a little bit, you know? But remember, some people may be hanging around or passing around, and you could not avoid that kind of interruptions. We try to do our best, and that's very important. We try to do our best to provide confidentiality. You know, one thing you don't do, you don't go to a community and access somebody's needs and then go to the neighbor and talk about what you access in the house you went before. That's not respect. That's not confidentiality, right? So those things, you will not do those things. You will always try to provide confidentiality, but it is not always possible in terms of the environment where you'll be delivering first aid assistance, okay? So that's the point right there. Okay, could we move? I think we're gonna have right now, okay? Another point important is remain within the scope of your expertise and your designated role. I talked about that already. Make appropriate referrals when it's needed or requested, okay, by the survivor. Be acknowledgeable of sensitive to issues of cultural diversity. And Dr. Veras is today with us, and she will be explaining cultural issues that we should consider when we are delivering PFA, okay? So let's hear, I think Dr. Veras talk to us a little bit about cultural issues. Okay.
Hi everyone, welcome to today's webinar. Can we go to the next slide? I think you need to, Dr. Gonzalez, this is your slide. Before I start.
Is mine or is yours?
It's yours.
Okay.
Now, okay. So, I will be providing information regarding information that is important to mental health providers about Hispanic and Latino, right? We want to provide this consideration for all of you, so you are more responsive to the Hispanic and Latino needs. We can go to the next slide. So usually in our minds we have different definitions of what culture means. So if you have the opportunity, you can write it down on the chat box, please. What is culture for you? We can go to the next slide. So sometimes we can define culture as a system of enduring traditions that govern beliefs about health and also about illness. Also, it includes childbearing practices, international expressions of suffering. So culture is embedded in all of us, and sometimes we don't actually acknowledge our culture. I don't know if you hear sometimes people say like, oh, this person does not have culture, or the people from this place does not have culture. So that is not true. Everyone has culture, okay? This is one thing that is really important to know. So a culture is defined by integrated patterns of human behavior that includes the language, thoughts, values, the way we communicate with other people, the actions, and also the beliefs and values. This is a more thorough definition of about what is culture from Cross. And the next slide, also it talks a little bit about the norms, right? If we have culture, also it includes some norms. It is related to some rules for accepted and expected behavior in a specific culture. You know, there are some cultures that they put some rings around their necks, but let's say in Latin America, it's not, usually people often do not do that, right? So for some African communities, that is part of their culture and it's normal, but for other culture, it isn't. So we can go to the slide of Latinx identity, the slide before. No, before that. Before that one. Latinx identity. So as Latinos, we have an identity that is different from one person to another person, or for people that live in a specific country, but at the same time, we have commonalities. The difference could include the historical context of migration. You know, we have people that migrate from El Salvador, so they want to go to the United States, so they have like more time immigrating if they're going walking, or if they have someone that is going to pick them up. It's a different immigration pattern compared to someone that is from Puerto Rico. They sometimes go take a plane and just go to the United States. So we need to have that in mind, that everyone, even if we are Latino, we have different immigration experiences. English knowledge, not every Latino knows English, and also it depends on the acculturation and also the generation. We usually have first generation of Latinos that sometimes they don't speak English, but when they have the second generation, the third generation, usually they speak a little bit more mostly English, and sometimes they forgot about speaking Spanish. So we need to be aware of that while we are delivering the PFA. And we could ask like which language is your primary language, so you can be aware of how the person feel more comfortable and how the person is gonna understand you better, right? And inside the commonalities that we have, that we speak Spanish, we have those cultural values that we'll be talking about during the next slides, during the core actions. And some of them includes what is familismo, espiritualidad, or personalismo. So those are common values that we usually have in the Latino culture. So we can go to the next slide, Cindy. So the next slide talks a little bit about what it means Hispanic and Latino and Latinx. And I just want to explain this because for a lot of you, this is like, okay, I know this. But there's a lot of people that are having difficulties with the Latinx term, right? And a lot of people from Latin America, they actually do not use Latinx. Like people that are living in Puerto Rico, Latin America, usually they don't use Latinx. This is like a new term, but also we need to be aware of it because it seems like the new generation, the millennials and generation X, Z are using more Latinx than other generations. And the why is they using this term? Because it's a term that is a gender neutral label that emerged during 2004. So they want to use this term to include people that does not classify themselves to a specific gender. So I think this is an important term that we need to be aware because sometimes we are delivering services to Latino, Hispanic, and we are using these terms. And sometimes if they don't feel comfortable with those terms, they're not going to be that engaged with you during the intervention. So are we going back to you, Dr. Miriam Gonzalez? Thank you.
Thank you, Dr. Velez. Very important, right? And it's important for you to know also that, as I said, the approach of PFA is very sensitive to cultural diversity, and that in the manual, you will always find a cultural alert. So when they think you should pay attention in the intervention to some issues that has to do with cultural issues, they will always point it out and you will see it in the manual. It's there for you, okay? So it's nice to know that it's there already for you and you could read about it, okay? Thank you, Dr. Velez. So let's keep on going and moving, okay? Some behaviors to be avoided as a provider of PFA, okay? And one of the, I think, do we have before that slide, please? Was another one? Right there, yeah, gracias. Do I make assumptions again? Go back. Okay, there we are, thank you. Okay, one of the things that we should not do is make assumptions, okay? There's an exercise that usually we do when we do the webinar in present. And it's that you could see somebody alone and maybe you could think that person is isolated, and it's not. It's just looking or just walking around, but you might see him alone and you could assume that he might need. Or you may see somebody crying and you could assume that that person is in an emotional struggle. No, maybe not. It's sad because there's a lot of losses in their life, but she's okay and she's sitting and she's having emotional support with a significant other. So the most important thing is not make assumptions. You always go and ask the survivor what is their need, and we will work with that, okay? Do not assume that everyone exposed to a disaster will be traumatic. It's traumatic. It's a traumatic experience for everyone. No, it's not. Okay? No, it's not. Interesting. Today in COVID-19, I could find people making their list about all the things that they have learned since COVID-19 is in their life. I could see people that's telling me that they have improved. And financially, there's some people that also are doing very good money since COVID-19. So we could not assume again that everybody has a financial problem, that everybody has anxiety, because it is really not true, okay? Do not pathologize. Do not label reactions. You know what? If I want to be transparent with you, I could tell you that is one of the things that I have to be all the time mindful when I am doing PFA. I am a clinical psychologist. So my wording, my usual way to communicate with others in my private practice is about talking about symptoms and disorders and all that kind of language, right? So it is very important for me to be very mindful when I am doing PFA, not use those words when I am delivering PFA, okay? How could I talk about reactions in terms of symptoms? And even in the webinar, you will be me struggling sometimes watching my language to see that I do not use pathologized language. It's very difficult when you are trained in that kind of scenario where you're always talking about disorders and pathology and symptoms, and you see somebody anxiety and you do not say, oh, that's a symptom. No, it's difficult. So watch out, be mindful about that, okay? It's very important. I think that the word that I try to use, and I try to be more mindful about it, is use the word is a reaction to. Okay, it's a reaction to. And you need to do that also, okay? And as I talked before, you know, when you look at literature, they will say that most of the people that going through a traumatic event, you know what? I will ask you the question at home and you could think about it. What is the disorder you could think that people, survivors of disaster may eventually have? I'm just gonna give you 1 minute to think about it. What's the first disorder you think people may have? And I guess many of you in your answer may think it's a post-traumatic stress disorder. And you know what? The literature says that's not true. Okay? When people are having a lot of stress and they don't work through their stress, you know, and to use coping mechanism to deal, and that's this stress is prolonged a long time, people could move to some kind of mental health disorder, but it's not usually PTSD. Usually it's an anxiety disorder. It could be depression related disorders. It could be substance use related disorders, alcohol or substance abuse, and later you will see maybe a PTSD. So usually we right away think people will have a PTSD, and it's not true. Mostly they will have, before a PTSD, we will see anxiety disorders or depression or alcohol use problems, you know, that kind of things. So important for you to know that kind of information, okay? So let's move on to our next slide, please. Okay, do not talk down or focus on his or her helplessness, weakness, or mistake. Oh, I know it's terrible for you. Oh, I know you have a lot of problems. Oh, I can see how you could manage all that kind of problems. No, 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 no. We don't want to go there. That's not the kind of intervention that we want to do, no? We usually want to make people feel they could deal with what they're having in front of them. They are resilient, they have coping skills, they have tools to work it, and if they are doing some kind of those things, we want to put it big, you know, you could see it, you're doing it very good, okay? I could not sleep. Well, usually people before after the earthquake couldn't sleep neither, you know. It's a very normal response, okay? Oh, my grandmother died and I can't stop crying. Yeah, that's a very normal response when people have lost somebody that they love too much, okay? So just validate and normalize and try to see the strength people have and work with the strengths that people have instead of put your focus on the weakness of the people. That's the point I want to make in this bullet, okay? Do not assume that all survivors want to talk. That's a myth. That's not true. You know what? I supervise students at in San Juan, and we sent students to do some intervention, voluntary intervention at a college in Puerto Rico. And that experience was with Maria, with the Hurricane Maria. So when students came back and supervised what happened, they said, I can't believe it. What could you believe? They didn't want to talk. We were trying to make people talk, the students from the college, and they didn't want to talk about it. And I said, really? Yeah, there was something wrong going on. And I said, you know what? Maybe it's your expectation thinking that everybody wants to talk about the hurricane and the experience they happened, and that's not true. And I also told them, let's see what's gone beyond the issue that they didn't want to talk. I think those students were very, very angry. They were asked to go back to the college. They don't have no internet. They were having problems with transportation. There was no electricity, so they had dealing with a lot of stress, and they were really mad. So I think that was one of the reasons why they didn't want to talk with the students that went there to give voluntary help to students. You see, so sometimes we need to acknowledge those kind of things that may be in the middle of the thing, and you need to see them to work with them also. Okay. Okay, let's go to our next slide, please. Do not debrief, okay? People usually think that if people talk and talk and talk, that would be okay to them. Not to everybody. And if you don't have any clinical tools because you're not a psychologist and a psychiatrist, you don't want to go to places where if something happens in terms emotionally to a person, you don't have the tools to work with them. So respect that area, okay? Respect that area. Do not speculate or offer possible inaccurate information. There's somebody gonna come to help you, and maybe nobody comes. So if you're not sure that the government is gonna give a help, don't talk about that if you're not sure about it, okay? Because you're creating a false expectancy of help that is never going to get there, and people will not trust us if we do that kind of thing, okay? So do not speculate. You know, here in Puerto Rico with the earthquake, people say there's another earthquake that is coming and it's gonna be bigger and we're gonna have a tsunami and all those kind of things, you know? That's not inaccurate information. What about COVID-19? Let's talk about a little bit of COVID. You know? How much speculation is around the disease and what's gonna happen? And you know, too much. We need to go to get information and validate that it's a good information. The resources that are given the information are trusted by us. And if you don't have the information, please don't give information that you're not really sure about it, okay? That's the point when you are giving PFA. Let's move to our next slide, please. What about when you're working with children and adolescents? Okay, number one rule is that you should always ask permission from the parents or guardians. Always, okay, always. Dr. Velez was talking about cultural issues related to this point. And you know what? In Puerto Rico, dad is the one who usually takes, mostly makes decision, mother and dad. And you should see who's the person in the culture that you're working who's responsible to make decisions. Because if you try to make some kind or connect people with services and you're not talking with the person of power in the family, you may have problems, okay, in that kind of intervention. So it's very important, and it's also in terms of our laws and 408 laws, you know, you should always ask for permission from parents to make an intervention with them. What happens if you are there in the field and you see a child and he's very overwhelmed or crying, or you see him alone? Yeah, you could reach the person, but as soon as possible, try to get the parents, okay, and talk to the parents. I saw him, he was lost, he was walking around, you know. I tried to reach him and take him to a safe place, and talk with parents, ask permission, and tell them what you did with the child. That's very important also, okay? Where you're talking with children, if they're sitting on the floor, sit on the floor with them. You know, they should be at the same eye level contact so they could trust you a little bit. Don't let them down and you up here. Authority doesn't work too much. So try, and with adolescent also, try to talk at the same eye level. Help school-age children verbalize their feelings, concerns, and questions. You know, you need to know here, and there is a developmental issue, who you're working with. If you're working with a 4-year kid and you're asking him, how do you feel? That's not a very good question for children. They will not understand, or maybe they could not put in words how they're feeling. Maybe they could touch their body and tell you something's going up here and it's feeling like this, and they will tell you how it is, okay? But maybe they don't have the language, okay, to talk to you and explain to you what are their emotions. So you need to take consideration about that. Also, dealing a little bit with these cultural issues, what about gender, females and males? You know, maybe you could see a female and she will write it, talk about her feelings, okay, that's okay. But if you're interviewing a male, maybe you say, how are you feeling? Oh, I think everything's okay. That's a male issue, right, Dr. Velez? Yeah, they need to be in control, they need to be in charge, they are not too good expressing how they feel most of the time, and you should take, you know, consider those issues in terms of your intervention, okay? Do not use extreme word as like terrified, horrified, you know. You want to be calm and bring calmness to people's life. So you don't want to be acting out and saying that something bad is gonna happen, and we're gonna have next week another lockdown, and the economy is gonna be terrible, and we're gonna lose everything. Don't go with those kind of statements when you're helping people, please.
Yes, and also something that we can observe in the Latino culture, that they can say this is a punishment from God. Like,
Yeah.
God is punishing us because of this, because of the COVID, because of the hurricane, of this situation. So we need to be aware of that sometimes they explain their suffering or the difficult experience through using a religious perspective.
Yeah, that's very true. And sometimes we also have to be very mindful in our language, because I may say God will help you, but maybe the person doesn't have any religious belief. So what are you talking about? You know, that kind of intervention is not going to be a good intervention. Or maybe you don't, as a provider, you don't have any kind of religious belief, but other person you're working with do. So you should be mindful of that. When I saw people in interviews in television in the South, I was really surprised how many people, usually older people, were talking, it's okay, God is in charge, God is in charge, we are with God, you know, and they usually speak about God, you know. So you need to be very mindful. People speak of God, you could maybe use God, but if they don't speak about God, don't use that kind of language for them, you know, to be respect with people's belief. You know, we're not intrusive, okay? That's important in our intervention, okay? Okay, and just make children know that you understand them also. That's very important to the empathy and to establish a good relationship with their survivors, okay? So let's move to our next step, and the next one. Okay, be aware that usually after disasters, children may show or develop some regression. Maybe they used to sleep at their bedroom in their bed, right? before the earthquake. But now, after the earthquake, they don't want to sleep alone again in their bed. They want to go to mom's and dad's bed. So that is a normal reactions of children after a disaster. So we need to deal with it and and manage it, but it's very normal that those kind of things happen. So mom maybe is very upset, but we could explain to mom that usually this kind of regression, we will be looking for it when a disaster has occurred, okay? It's normal that this kind of things happen. We'll work with it, but they are normal, okay? Match your language with the child developmental level, very important, so they could, understand what you are saying. Talk to adolescents, adult to adult. I don't like to be treated as children. They like to be treated as adults, so you should take that in consideration also. Reinforce this technique with parents and caregivers to help them provide appropriate emotional support. Sometimes dad and mom, they don't know how to support their children. So you could give them the information. How could you deal? In the manual, you will find out some handouts. They explain some of the tools to parents, not to the children. So we are giving information to parents, and parents will handle the information with their children. So that is one kind of the interventions you will see in PFA, okay? Handouts. Okay, let's move to our next one, please. Working with older adults. Let's go to COVID-19. What's going on with older adults right now? I wish we could be in vivo and you could talk to me a little bit about your parents at home, elderly people. They are suffering a lot. And one of the reasons right now for older people to be in very stressful situation is that they are in the vulnerable population list, right? So they are very scared to go to the supermarket or to the grocery stores, to get at home. They need to buy food. They need to go to doctors, but they don't want to go to the hospitals, right? They don't want to go to medical office because they are really, really afraid that if they visit hospital or if they visit a medical office, they may get the COVID-19. They will get infection. They will get infection. So they're having a very difficult time. Number two, with social distancing, the family usually doesn't visit their older parents and family members. Okay, so they are really social isolate. Most of us could have internet, or we could chat, or we could go to Facebook, and we could keep in touch with people. What happened with the older adults? They don't are technology people. They maybe don't know how to chat. They don't know how to go to Facebook. They don't know how to do a Zoom party as Miriam Gonzalez do, okay? So what's going on? They're feeling very, very alone, okay? So we need to help them. They are bored, really bored at home. So we need to help them find some kind of activities they could be doing to work with their time management, okay? And to help them go through the stresses and the isolation and the boredom that they are feeling right now. And usually this the older people are very vulnerable to information they see in TV or they hear in TV. You know, I could hear information in radio or in TV and I say, oh, they're doing a real big stuff about it, but it's not so bad about it. If my mother hear the same information, she will be very worried about it, okay? That's one of the reality of our older adults. This morning, I was having a conversation with my mom. She was having some physical discomfort, and I think she was a little bit worried about it. And I said, you know what? You know, my sister was having some kind of issues with health, and I know she's very worried because she's always thinking that if we have COVID, we're gonna die. And I said, no, not everybody that have COVID will die. 80% will not die. You know, I'm a very healthy person. I'm younger. I think I could navigate through, and I will feel bad some days. No, I'm not gonna die. Because you always think that if you hear COVID, it's that this person's gonna die, and that's not true. So you need to provide those kind of information to our adults so they could believe. But you know what? I don't know why, but adults will hear anything in TV and they will usually say that's true, and they will be very, very anxious about what they hear in TV. And you know what's going on in TV. They big a big issue and everything is very terrible. So they are really, really affecting this kind of population. The older adults are really, really having a bad time with that. Okay. Also remember, when you're working with all the older adults, there can be confusion. There's some maybe dementia or cognitive problems that you should address with these persons. Remember also, I think it's on our next slide. Let me see if it's true. Yeah, let's move to our next slide, please. Next slide, please. Okay, thank you. Okay, sometimes they have hearing problems. So if you're a provider with an adult, older adult, you should be you should know if the people could hear you. Ask, do you have hearing problems? Could you hear me? So that's very important that you realize that they could do it. Sometimes they had windshields and you need to move them to some place so you could talk with them, but they need to be moved because they're having moving problems, okay? So it's important to you to address all the issues that this kind of population is having, and you could help them right away, okay? They may be disoriented if you have dementia and that kind of stuff. They usually have a routine and you take them out of the routine. So they will feel very disoriented initially when this earthquake or hurricanes or disasters come over. You could also look for those signs and see it's normal for that population. Okay, so let's move on, please.
Miriam,
Yes.
I just want to add about that we can observe that sometimes older adults, they go to group meetings or places where they used to spend the whole day doing different activities there. So right now, because of the COVID, they just not does not have that type of support right now. So they feel more lonely. Also, I had a client that she usually loved to go to the casino to spend time with her friends, to talk with her, with them, and to spend a little bit of time to drink a coffee, you know. And right now, that's something that she cannot do because of the COVID. So that's an example of that maybe lonely that they can experience through this crisis.
Yeah. I could say about my family, they're very Christians, and not going to church is a very big issue for older people right now. You know, if I talk with my mother, she would say that is the best, the bad thing about it. This is the worst thing. She could not go to church, and she's missing a lot going to church. Okay, so yeah, all those kind of things will happen. Okay. Okay, so working with survivors with disabilities, that's also important to know. You know, if person says they had a disability, even though you look at them and you think they don't have any, you should always acknowledge what they say. If they say they have a disability, just go with that, okay? They do have it and work with it. Ask how you could help them. Sometimes we want to help somebody to walk and they will not like that because they want to prove their independence and they could walk. But others really will like you to handle your hand and help them, okay? And move from one place to another. So you should be very mindful about that also, okay? When possible, enable the person to be self-sufficient. That's very important also. Okay, if the people are blind, or visually impaired, how to usually help them fill up the handouts or papers they need to do that. So be mindful about that always. And some people may need oxygen or some equipment or a wheelchair. And maybe the way you could address the need is finding this medication or instruments, okay, or the wheelchair for the person. We need to help them with that, okay? So be mindful about that also. Okay, let's move to our next slide. Preparing to deliver psychological first aid. Okay, what is planning? Planning, what are you gonna do? Be knowledgeable about the nature of the event. If you're gonna help somebody about COVID, let's say that the person is having a lot of anxiety about being infected with COVID-19. So you should have all the information how people could get infected by COVID-19 and what are the measures they should take to prevent getting infected by COVID. So if you're going to work with COVID, you need to have that kind of information. And there are a lot of doubts, okay? Believe it, okay? If should I take my shoes off when I get home? Should I take all my clothes and wash it as soon as I get home? You know, there are troubles in families because some people say, yes, you should do it. And you're putting at risk our family, and others, no, that's not true. No, so that kind of information, you need to have it so you could explain them, okay? And give it the real information, okay? We also, and one of the things that in the university where I work, we find out that volunteers went to some community to help, but we didn't have any kind of information about availability of relief and support services. For example, some of the mothers asked us if there was any kind of help with their children. They were having 3 or 4 children. Maybe they need to go to a doctor. Nobody could take care of their children and they need to go to the grocery or other places. Is there any kind of services that may help? And we didn't have that information. So one of the things that we done when we were supervising students and we were talking about it was that we need to look for what kind of help these mothers could have. So we could give that information to those moms and they could access the services that they are needing, okay? So that is very, very important. If it's an earthquake, let's think about that as an example. You should first see how is the road. Is okay? Is it safe for you to travel in that direction in the road? Okay. Once I was going to Ponce, and I don't know how you say that word in English, derrumbe. You know how you say derrumbe, Miss Bellas, in English? No? There were falling rocks in the road. Okay. And it was not safe. It was not safe to travel in that moment to Ponce. So I decided not to travel because I think it was a safety issue. And if I want to help somebody to be safe, the first person that needs to be safe is me. Okay, so that is very, very important that you know. You need to see the safety issues for yourself and for others, for both of you, okay? When you enter to deliver PFA, establish communication with, as I said before, with community leaders, with agencies that are already there and maybe coordinating services. You should say your name, your role, what you could do to help, or ask how you could help, and they may assign you where you should go and what you should do and how you could help. And that is very, very good, okay? And when providing some setting, PFA can be provided in designated areas. So they say you could stay here, but you cannot move from here. Okay, and they will bring people to you. So they will go around and see who needs your help, and they will coordinate and take the people. Okay, so you need to find out that because we don't want to be breaking rules community already have arranged or have made to make possible those services, okay? And focus your attention on how people are reacting and interacting in the setting. Shelters, there were a lot of problems. People were fighting with each others. What the problem with the dogs and the pets and the kids, and it was raining and it was flood, you know, a lot of problems in the setting. So you should be aware of all those kind of issues going on to see how you could manage it and work with them, okay? Very important when you're delivering PFA, okay? Okay, said keep on. So let's go really to our first court action plan, providing services, okay? What do you want to, if you are in a place and you want to see who need help, okay? I think the best way to help is look your surrounding, hear, okay? Use your senses, okay? Looking, hearing, smelling. I always do that. When I'm supervising, I said to my student, what do you think that I are usually trying to smell? I don't know. And I said, oh, I want to see if there's an alcohol around. So I will try to smell to see if the person that I'm doing an intervention has been using alcohol, okay? Because that could bring other kind of problems in the intervention. So I need to make sure if the person is sober or has been drinking, or I am watching his eyes. I want to see if there's some drugs around or if the person is disoriented, okay? So looking and listening and smelling, use your senses, okay? They are very, very good and will protect you. Sure about that also, okay? So when you go to the setting, and we have right now in the slide this picture, right now you see a lady that's like this, you see somebody old and somebody's trying to help. You could see somebody like talking with a child, and maybe you go and that's the scene. Who is the first person maybe that you want to approach when you get to that scenario, okay? Who do you think may need the help, okay? And we don't assume. We get to the person and we will ask if that they really need the our services, okay? So disoriented, confused, people may be very confused, agitated, panic, very panicked, extremely withdrawal or apathetic, shut down, extremely irritable or angry, extremely worried. So we'll try to check out to see who may be having this kind of responses, and maybe we want to reach them to see and ask if we could help them in any way, okay? So that's very important. Remember, look, and listen. Okay, so let's go to see our PFA core actions. Okay, our next slide, please. Okay, so we talk about AID, right? Our first module, what we will be learning in our first module is how to do the contact and the engagement. The goal to respond to contact initiated by survivors or to initiate contact in a non-intrusive, compassion, and helpful manner. What that means is there's two ways people will get to people. Maybe the people will reach you. You're in a place and the survivor just go to you and he wants to talk to you. Maybe it's not the point. Maybe you're walking around the field and you will see somebody that may need help, and you will go to the person, talk to him or her, and ask if they need any kind of help. So there are two ways you could get to the survivor, okay? Safety and comfort. That is our second core action. In PFA, safety is very, very important. Maybe the immediate need in the earthquake was to take people out from their house because it was not safe, okay? So we need to move them to shelter. And that was our first intervention, okay? Help people get to the shelter. That's very important right now, okay? Right now, Safety and comfort is very difficult in COVID-19. Okay, why? Because right now, one of the people that are at more risk right now are people working in health scenarios, hospitals. Okay, they need a lot. Okay, sometimes the person that need is the person that has been diagnosed as positive to COVID-19. But as soon as you know that somebody is positive to COVID-19, you are always, I could be also contaminated with that, with infection. So see, there's safety issues you need to address. How we're going to work with families, or what kind of orientation we're going to give to a family member. If somebody in your family is COVID-19 and it's not in the hospital, it's in your house, what are the recommendations that they need to know that they should do to look for them to be safe, right? The person must be in the room must be locked. What are we going to do with dishes? They have to have their special dishes. What about bathrooms? What about if there's only one bathroom in the house and the person that has COVID-19 is there using the bathroom and the rest of the family is using the same bathroom? You see? So there are safety issues that you should address right away. And sometimes providing information, how could they deal with that, you know? Okay, it's only one bathroom. So both of you need to use the bathroom. The person who has COVID-19 and other members of the family, because they need bathroom. What are we gonna do? So we're gonna disinfect every time the person use the bathroom, okay? Cleaning, 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 disinfecting, disinfecting, disinfection for everything to try to be, okay, safe. So right now, one of the things is how comfort could we feel reaching people that are working in a hospital? Let's put that example. You know, I have a friend and he's a doctor, emergency room, okay? And his wife is my best friend. And she said, I feel so isolated. Nobody wants to go to my house. Nobody wants to be near us because my husband is a doctor and he is at high risk. So we don't have no kind of relation with neighbors, with friends, with family members, because nobody wants to visit us, you know? So they sometimes feel very bad about it, you know? They told me, hey, Miriam, we're gonna make a COVID test, and if it's negative, could we visit you to a little bit? You know, they were really, really bored, and they were feeling very alone. So those issues are there in terms of safety if we want to apply PFA to COVID-19, okay? You should take that in consideration also. The other court issue or action, excuse me, in PFA is number 3, stabilization if needed. Why if needed? Because we had said before that not everyone is going to need stabilization. Most people went through Maria, went to the earthquake, has been dealing with the pandemic, and they don't have no signs of distress. So you don't have to work with them. They don't need no kind of stabilization. So you need to see really who are the people who really need that kind of help, and if needed, and then you will provide it. Our 4th module will be information gathering. And there, the goal is to identify immediate needs, okay? Let's give an example a little bit so you can understand what we're doing here. Suppose you meet a person that wants help because he's not really sure if he's going to stay in Puerto Rico or he's going to move to the state. That usually happen a lot with Maria. People were traveling to the state after the Maria hurricane. So maybe that's not immediate. That may happen 3 months later, 4 months later. So that is not immediate. So we're not looking for that kind of thing, you know. We're looking for, you need food, you know, you need to go to the hospital, Your anxiety level is too high, and we need to help you with a coping mechanism. You're fighting a lot and sleeping fighting. Okay, children are bored, are acting out at home. Immediately has to do with immediately. What could I do right now? I'm going to give you a tip. You should be in your mind should be, what is this person next step? I'm going to repeat it. What is this person next step? Okay, that's the point. What they need to do immediately. What's the next step? I should meet the person, and that's the focus of your attention. Okay, let's move to our next one. Once we gather information and we have the information, and then we'll move to our 5 model practical assistance. The goal is to offer practical help to address the needs and concerns of the person. Number 6, and this is very, very important. Resilience and trauma literature will say that if people is connected and have social support, they will go through more easier the stressors. Okay, if people are disconnected and doesn't have social support, they are at a higher risk for developing future, mental health problems later. So social connection is a protection factor, and we should highly look for people to be connected. What's going on with COVID-19? How easy is for people with COVID-19 pandemic getting connection and support from others? Not so easy, okay? Remember about social distancing? So, social distancing, I was surprised yesterday here in Puerto Rico. I didn't hear the news really, that people will not go to the beach on Sundays. And I live in front of the beach. So I hear the police all whole day, okay, making people get out of the beach, because in the week, people could go to the beach. They could not be in the sand, but they could go in and take a bath in the beach and then go out. But I didn't know that Sunday it was prohibited by the government. So yesterday was a lot of people running from, because people need some kind of activity. Sometimes they need to go out of the house, okay? I remember the first time they opened the news, I was really bothered by the news. They said that everybody was in the beach. No, everybody was not in the beach. They were in Piñones in Puerto Rico, but they were in the car. Everybody went in the car and they went to travel around, to see something different of the walls of their house, but not necessary. All the people were in the beach. So people need activities, people need connection, and we need to see, even though we are in distant social distance, it's about physical, not getting too physical, but you could be connected with people through the phone, through internet, chatting. There's other ways you could still connect with people, and that's something we want to work in COVID-19 to help people go through this pandemic healthy. Okay. Information and coping. People need, this is a very nice model. I love it. They will give you a lot of information how to work with intrusive thoughts. What about COVID-19? Let's talk a lot about COVID-19. Intrusive thought. I think I have COVID-19. I want to have a test. I need a test. There's a lot of intrusive thought people are having, okay, in terms that they are ill. Different from the earthquake. In the earthquake, the intrusive thought was, we're gonna have another earthquake. There's another one coming. Everything is gonna be bad. We're gonna lose everything, different intrusive thoughts. But in COVID-19, the intrusive thought is, I think I have COVID-19, okay? If something hurt, if you cough, if you went, what I have seen in my office? If people went to the supermarket, the first time they went to a supermarket, they were so afraid, and they had a lot of intrusive thought thinking that they visit the supermarket and they had the COVID-19 right now. And a lot of people told me we went right away to have a COVID test, okay? And I knew people that they had about 4 COVID tests, and I said, what's going on? It was because they were having a lot of intrusive thoughts, okay? So in the manual, you will find out some tools to how to help people go through intrusive thoughts, for example, okay? So we will learn a lot about that in Wednesday that we have our next webinar, okay? And the 8th model is about linkage and collaborative services, right? How to get people to the doctor, how to get people to the COVID test. Today, last week, I received people asking, does somebody know where we could find a COVID test in Puerto Rico? Because a lot of people are going to a surgery and they need the COVID test as part of the protocols so they could have the surgery. And there's any place in Puerto Rico last week that they could find where they could have the COVID test, the molecular one, the one the doctors were asking for the surgery. So the people were really, really worried about where they could find the COVID test and what lab was available for them, okay? So that kind of information, maybe people will need about it, okay? Okay, we keep on, Miss Bella. Something else you want to bring? We keep on.
I think that after this part, I will add some at the end. When you finish the content engagement, I will provide a little bit more.
Okay, okay. So let's talk right away, a few minutes, and then we could open maybe to questions. The first model is how you make the contact, how you introduce yourself. I think Bella's gonna talk to that a little bit, okay? If you see the manual said, you will say, I am Mr. Green, for example, right? I don't think that's really that's a cultural issue in Puerto Rico. I don't think we will go with our last name to make that engagement. Usually we do not, okay? So one of the things you want to do is how you will introduce yourself with your name, your title, and describe your role. That's very, very important. Number 2, don't be intrusive. Ask permission. May I talk to you? Okay, really ask first. Okay, don't start talking without asking permission. Maybe the person didn't have the time to talk to you, you know, or don't want to talk, that's all. So you need to ask permission to see. Explain that you are there to see if you could help, you know. You know what? Not everybody some people have trust issues, you know. And sometimes I heard people saying in some vulnerable population, oh, I think this is the government that wants to have information and then they will, you know, go after us. So they may be distrust about it. Also, they are distrust because so many people sometimes have said that they will help and they didn't help. Say they have lost trust in people that said that I will help you because they think they can. And if you can help, you should say always, I cannot help you with that. That's also important for them to know, okay? Invite the person, if it's possible, okay, to sit down and to ensure some level of privacy for the conversation, if it's possible, and give the person your full attention, okay? Speak softly and calm. Okay, let's move to our next slide, please. I think I was reading the next slide. Yeah, that was all what I was saying right now. Okay, let's move to our next slide. Okay. Find out if there's any pressing problem that need immediate attention. Okay, if somebody is having a blood pressure, blood pressure, maybe you're not going to do any kind of intervention. Maybe you need to take the person to a hospital, okay, and have some evaluation by a doctor. And then you could proceed with PFA. But in that moment, the first thing you need to do is safety. And safety is if the person is having a high blood pressure, he should go to the doctor first, okay? That's more important than anything else in that moment, okay? So you should take that in account. When making contact with children and adolescents, make connection with their parents. I told that already, okay? And explain your role to the children and to parents and adolescents also. If you speak with child in distress when no adult is present, I told that already. You should try to move as soon as possible to reach parents or guardians and talk about how you could help them with any concerns or situation that they may have. Okay. Okay, next slide, please. I think we already talked about confidentiality. It's very important for you to try to protect confidentiality, but not always is possible. Okay. So right now, what about COVID-19? You know, people having positive, you need to tell other persons to protect them. So you know how confidentiality doesn't work right now when we're working directly with COVID-19, because it's a health problem, infectious disease, and usually people they were in touch with in the past days should be informed, you know, about the situation, so they could always also have a COVID test. So there's a lot of issues dealing with this stuff also. Okay. Okay, Dr. Velez, all yours.
Okay,
Next slide.
thank you. Next slide. I just want to clarify that as a Latinos, ¿verdad? We are like, we love to be with other people. We are really, really collectivistic, right? And we love to be affectionate towards other, abrazo y beso, and that's why this moment is like really, really hard on us, right? It's really difficult for us as a Latino culture to be careful, but also be affectionate towards others, but being careful. So about the barriers to access mental health care services in Hispanic and Latino group, but also in our Hispanic and Latino population, we can observe that there's a lot of difficulties having insurance, having a lot of stigma about mental health conditions. People sometimes they don't know what means, what a psychologist do or what are counselors for, you know, and they present those difficulties because you know, for sure, a lot of people just don't want to talk about mental health. They don't want to talk about depression or sadness or nervios, right? And I'm presenting these barriers because for me, I want you to know that as a provider, and providing the PFA, you're gonna make a huge difference in this person's life because you could be the bridge connecting the person with services around their community, with services right now like telehealth services if they want to, right? So I want to acknowledge that you will make a lot of difference in this person's life. Some of the barriers that a lot of my clients, I observe in a lot of my clients from Boston, is like when they go to a psychiatrist or they have an appointment with someone that only speaks English, or there are a white person, they usually like put a barrier there because they sometimes if the provider does not have those skills of that warm, or if they don't know about the Latino culture, the person feels that they will not understand them. So as if you provide this PFA, it will help you to connect with the client so you can make those referrals if they need to. Okay. So we can go to the next slide. So usually we need to ask, just like Dr. Gonzalez said, we don't need to assume, right, if the person speaks English, Spanish, or another dialect. We need to ask them. We need to approach the person with not just a mental sense, but also to be transparent and to be clear, you know, who you are and what you're doing there. And I think because when people are not transparent and they're like more clear and more compassionate to other people. And also I want to talk about the value of personalismo, because usually personalismo means in our culture that we like to have a relationship with our provider, or we want to have a relationship with the doctor, right? And personalismo is a cultural values that helps us to connect with others, but at the same time, it creates a little bit of conflict, because if the provider is not like speak or with a smile, sometimes we feel like we are not connecting with that provider. So personalismo is, let's say, a cultural value that could help Latinos to engage in PFA if we approach them with a more sincere approach. We're more compassionate about the situation that they're going through. So I think this is my last slide for today, and I want to thank everyone that was here for almost 2 hours now. And if you have any questions, you can write them on the question box on the panel. Dr. Miriam, you want to say?
Yeah, I think it would be great if we could take some question, if somebody wants to make any comment or question.
Sure.
Okay, we're appreciated. We're here for that. And remember our audience that we will get back on Wednesday at 1:30 p.m. to continue with the second part of the PFA training.
Yes, and also on the next session on Wednesday, we're gonna add the presentation and the handout box, but also the PFA manual, because we did not add it today, but we're gonna have it for the next presentation.
Okay.
I don't see any questions as of right now. I do see someone press like the little hand thing. So if anyone has a question, please submit it directly to the question box, because I can see some people raise their hand, but you need to write us the question through the question box. We are getting a couple of messages about thanking both presenters for the information, that it was great, that it was excellent regarding the understanding of respecting the culture, which is critical. Someone wrote if they can get some insight on children from, I guess, the age of like newborns up to 3 years old.
So it is information regarding the delivering the PFA children from 0 to 3. I don't know if the person that wrote the question will add a little bit more information.
Yeah, I think basically that you need to know and to address the developmental age of children to decide what kind of intervention you will be making. One of the things that we usually work in PFA and SPR is that most of the time the intervention must be done with parents. You know, if parents are very anxious in what they are saying at home, the kind of conversation they are having, and the acting outs that parents might have will influence and impact children very, very much. Okay, so in most instances in PFA, what you will do is to give information to the provider how they could manage their own anxiety as parents, right? And dealing with what's going on in the pandemic, earthquake, whatever the disaster was, and helping them so they could role model in front of their children calmness, security, because safety issues and security for children, it all depends on how the children see dad and mom. if mom and dad will model for them that everything they're taking care of everything and everything is okay, children will have that information and internalize that information. It's going to be okay for them also. But if mom and dad are having conversation of bad things and very horrible things and all that kind of stuff, children's having all that information also, and that will impact in not a good way to their children. So I think that when they are little, 0, 3 years, they're still real little. I think most of the things has to do with psychoeducation to parents, how to manage information and how to model in front of the children. Also to see exposure the children are having to TV and radio and all those kind of stuff. Okay, and also it's very important to know that children's, even from 0 to 3, their routines have changed, and parents need to acknowledge that kind of thing and be mindful and take some action. What kind of activities they could be handling or doing with their children, so they could play with them and do some exercise, and looking for the sleeping patterns to be the same, to help their children of those ages. Okay. So sometimes I could hear in Facebook or chats of my friends that what other games could I play with my 2-year-old, because I have done everything and I need something else for them. Yeah, that kind of stuff, they may need help in that.
Yes. And also the National Child Traumatic Stress Network, they have like a lot of resources for children from 0 to 3 or adolescents too. And I also want to say that for the next session, one of the resources that I will be sharing is the family preparation plan. That is, I will send you the link and you will see everything that this is a resource for parents that maybe they're here to get supported and they can create this plan to here is something like that happen. So this is something that you will have through our next session.
Mm-hmm.
Thank you both for that insight. I don't see that we have any more questions. So
Okay.
I want to thank you again both for today's presentation. I think we got great feedback and everything was well explained. And you guys already talk about our next session, so I want to keep on talking about that. I do want to say, I know Miriam said at the beginning that we were going to give you the PFA handout. It's not attached on today's presentation, but it will be available on Wednesday when we see each other once again. So make sure you look out for that, because today you only had the handout for the complete presentation, but I will be adding the other handout for our next presentation on Wednesday. So have that in mind. And you will also receive the certificate after the next presentation, not today. So have that in mind, because I know sometimes people get anxious of getting their certification right after the event, but know that you will receive it after the second event, because it will be like global for both parts. So with that said, I think we're good to go. I don't know if Miriam or Isa want to say something else before we leave.
Thank you all. We'll see you Wednesday.
Yeah, thank you, everybody.
Thank you, everybody. Have a great day.
Same. Bye.